Welcome again to this episode, and I hope that your psalm is going on well and that you are really taking advantage of this month of Ramadan to better yourself. And remember, all of us in Dua and the Muslims in general, and even our brothers and sisters who are fighting for their lives in Palestine and all other places. All right, so today we are going to talk about the withdrawal symptoms. So what are withdrawal symptoms? Before I go to withdrawal symptoms, I remember I wanted to talk about detoxification in the last episode, which I did not get to say what it is. But you find that on addiction, now that we already understand what addiction is, at some point people now seek help, or their families seek help on their behalf. So you find that if this person was addicted to some substance and they go to a rehabilitation center, times they have to go through a detoxification process, which is the removal of the toxins. Remember we said that these drugs, they induce some toxins like poisons into our body system. So before someone can even start to be taken through steps of healing and all that, you find that in some cases they have to be detoxified. So that is something I don't want to go deep into that because it's something that is done by the rehabilitation centers or the doctors who are in charge of this person who is healing, now in the process of healing from addiction. So what happens is those toxins, through the process of they use certain kinds of medications to help them remove the toxins from the body. So once those toxins are removed, I'm just looking at this and relating it to Ramadan, for example, because during Ramadan, when you're fasting, you're staying away from the drugs of abuse or the behavior of abuse, okay? So when these toxins are removed, at times we think that this person was detoxified, so they should get better immediately, but that's not the case. Because remember I said there are some effects that happen into the person's brain. There is some inflammation or shrinkage of the brain. There is a lot of things that are happening in that person's body. So the detoxification gets them to a certain level of stability physically, but that does not mean they have already healed from addiction. And maybe let's start looking at that in relation to when people are fasting, okay? So the fact that they've stayed without that substance of addiction from morning to evening does not mean that they have already healed. And maybe when we are talking about the way forward, you're going to see the things that would help someone heal, and probably this issue of the ibadah that they are doing and all that is part of it, but there is also need to have that support and that working, like a holistic way of working with the addiction, healing and recovery, and maybe as you shall see. So having talked about the detoxification, so let's look at what is withdrawal symptoms or syndrome. So because it's a number of things that affect someone who is withdrawing from addiction. So you see, if I look at the ayah that talked about the prohibition of alcohol even in Islam, remember how it started that people were told do not approach Salah while you are intoxicated, and then eventually we were completely told to stay away from alcohol, right? So I could be wrong, but that maybe points also at, I'm just using it to point it to the fact that there's the fact that this behavior, it is gradual. It takes time before someone can completely heal from addiction. For example, alcohol, you cannot just stop it like that without assistance and doctor's intervention, because people can even die of stroke if they just stop abruptly. So those are some of the facts that we know about addiction. So withdrawal symptoms means that when you stop that drug or substance of abuse or behavior of abuse abruptly, there are some effects that come with that. There are some symptoms that someone goes through. And at times, these symptoms stay with that person for a week. In some cases, different drugs at times for a month. In some cases, maybe 2 months. In some cases, 10 days. And even after that, the effects continue, even if they will be now milder. You see, just take an example of when you get injured, for example. You maybe fall or you cut yourself. So in the initial stages of nursing that wound, you find that the wound will be very toxic and very painful and all that. So now place the person who's recovering from addiction in that situation, okay? So this person is healing, the wound is healing, but after maybe 2 weeks, 3 weeks, it has healed, but there is a scar. But okay, if you tamper with it, you start bleeding again. If you don't take care of it well again, you do what? You maybe start again forming pus and all that. So the same way when we're talking of withdrawal symptoms. So what happens is that when someone stops using the drugs or substance of abuse or the behavior of abuse, they start getting things like anxiety. They start getting like they lack sleep the way they would sleep, a normal person would sleep. So like they have sleep disturbances. You find that they also have fatigue, wanakuwa na uchovu ya kila mara. Then they also they feel like they're not happy, wanakaa depressed, anxiety. Then you find that they're like irritable all the time, maybe wanakosana na wengine, all right? So these symptoms could be there for all those like days when this person is still recovered. I mean after the stopping that substance or behavior of abuse. So the withdrawal symptoms continue irritating someone. So while us we are just seeing that person and looking at them, it's as if, why don't you just stop? We soma tu doana wachane na hiyo drug. Okay? It's unfortunate. We are not saying drugs and substance are good, but now once someone is there, that healing process is a process, as it is, as we are saying. So when something is a process, it's not something that you stop now and now. So these are the things that they are feeling. And remember, in the effects of drugs and addiction, we said there's the lack of control, the loss of control and all that. So when all these things, they are there all together in someone's body, and immediately after iftar unaona mtu anaenda nakimbilia sigara because of this withdrawal symptoms, okay? So they still have that push to get into that behavior. So they are not yet fully recovered. Even if they went through a detoxification, they still have the inflammations and all that, and they'll still go through these symptoms. And we've said even afterwards, even after there may be the, where we say the 10 days or 1 month of the time that they experience the withdrawal symptoms, they will still have like an effect of these things. And there are times it's just like, for example, you are healing from a loss and grief, so you're grieving something, and then after some time it gets better. But kuna time, maybe when the anniversaries are manini, you find yourself feeling so sad, or something just triggers you and you feel so sad. So they go through such, okay? And at some point, maybe we're going to talk about the relapse when you're talking about the action plan for someone who's recovering, maybe relapse prevention plan in the way forward. But these are now the withdrawal symptoms, and these are the push factors that usually trigger someone to, because they've not completely healed. The healing is a process. So unapata even after Ramadan wengine anafanya nini? Anarudi tu kwa zile madrugs na anarudi tu kwa hiyo majaba, okay? So what I would say is let's taking advantage of Ramadan because it's a time for rahma, maybe taking advantage of that time to do what? To say, now this is the time I want to start my healing journey, okay? Let's look at addiction recovery as a journey and use Ramadan as a time when we support our loved ones and even the people who are healing from addiction also start that journey there, because we all know that behavior can be changed, but over time. And when there are medical issues, they also need to be taken care of. So as we said, we will see it's holistic. Yeah. So until the next session, assalamu alaikum wa rahmatullahi wa barakatuh.